Transition Tuesday. I'm Jane. This is Joe. So, considering the fact that due to the high number of cases of COVID and RSV at Children's Healthcare of Atlanta, we have had to reschedule Joe's surgery 3 times. So healthcare is on our mind right now. And so we thought this would be an absolutely wonderful opportunity to talk to you all about transitioning to adult healthcare. What some things around that that you need to consider as a family of a person with a disability. So Joe, let me ask you, is it important for you to be involved in your health care as a 20-year-old man? Is it important? Touch my hand or tell me with your voice. Is it important for you to be involved? Is it important to you that you're involved? Yes. So Joe's on some pretty heavy-duty pain medication because of his hip, and it makes him a little sleepy, as you can see. So just full disclosure, Joe is not his peppy self right now, but he's not in any pain, so that's a good thing. Healthcare transition. Home is the heart. Now, schools will do some transition discussion about healthcare, but really and truly, I think the most appropriate and the best way to do transition planning around transitioning to adult healthcare services is really at home, because home is where appointments are made. The school doesn't make doctor's appointments for your child, you do. And you have the lists of phone numbers and medications, and all those things really are home-based. So really doing that transition planning is most appropriate to do at home. So here are some questions to ask yourself, whether you're a parent or a direct support person or a caregiver or a grandparent, mom or dad, sibling, whoever is assisting the person with a disability in learning this transition skill. Ask yourself, do I know how long the coverage for my child will last on my current insurance policy? What age does that coverage end? It varies. Sometimes it's based on whether or not that individual is still in school. Sometimes it's based arbitrarily just on well, not arbitrarily, but on a number and an age. Is my child on a Medicaid program that ends at age 18? If your child has a Katie Beckett waiver in Georgia, that ends at age 18. So you need to be aware of any transitions in coverage that will occur at certain ages of transition. Will my child need an advance directive? So what is an advance directive? Well, if you have an older parent, you may have already done this process with them. It identifies a representative who can speak on the person's behalf if they are incapacitated. It identifies things like a DNR, do not resuscitate. If you do not want medical interventions, and there can be some pretty specific questions about that. It identifies those things. But really for a younger person, it's more about who would be designated to be my spokesperson if I am unable to speak for myself. Who would be allowed to see medical records, speak with doctors. You may have to sign a release of information and some things like that, but the advance directive tells the hospital or the doctor's office what the wishes of the person are regarding who can know about their medical information and who can speak for them. It's a pretty important thing, and it's worth the discussion. When Joe turned 18, we discussed this kind of simultaneously with applying for Social Security. Some questions to ask about with your teen. So how much does your teenager know, your almost 18-year-old know about all these things that you do on a routine basis for their health care? Can my teen describe his or her health care needs? For example, your child, do they know if they have asthma? Do they know what their disability is or what their diagnosis or diagnoses are? When they have that conversation as an adult with their adult healthcare practitioner, they need to be able to know these things. Even if they can't pronounce them, point them on a list or something. Does my teen know the name of his or her doctors and maybe what their specialties are? This is important, especially if you're transitioning out of pediatric to new doctors. What a great place to start with transition planning for healthcare is, maybe your child can even have some say in who the choice is about who will serve them as an adult practitioner. A good place to start with that maybe is switching from a pediatrician to a family medicine practitioner. That's a good place to start. It empowers your child to know, okay, I am going to be an adult, and this is one of those things that I'll be doing as an adult. Can my child see or access a calendar with appointments? Well, that's a pretty basic thing, and it's one of those things that I can speak for myself as a mom. I'm looking at my calendar to see what appointment time will work for me. But when your child transitions into adult health care, it's a good practice to start involving your child in making those decisions about appointment days and times. So for example, you know that your child has to have an appointment, say, with the cardiologist coming up. So you say, okay, so let's look at the calendar and see what might be a good day. Practice what you just do instinctively. Talk through it with your child. Help them see how you put it on the calendar, what information you put on the calendar, and how to access it once you've put it on that calendar. Some people still use paper calendars. Some people just put it on their phone. They can put it on their child's phone, which is a pretty good way to do it. And I know a lot of parents who keep a paper and a on your phone calendar. Do I involve my teen in signing the sign-in sheet at the doctor's office? So that's a really good practice too. So when they get to the doctor's office, you start getting in the habit of having your child go up to the window and say, hey, my name is Joe Grillo. I have a 10:15 appointment with Dr. Smith. Good practice. It's an adulting skill that many kids who don't have a disability are clueless about. When our daughter went to college, she got the flu and got so sick and had to navigate the on-site clinic at her college all on her own, and it was a big experience for her. So it's kind of better if you can practice these things ahead of time. Does my child know what medication he or she takes? And I'll add what they are for. Do they know? This is important because if your child wants to go to a post-secondary program after high school program where like Warm Springs, or a post-secondary inclusion program at a college or tech school where they live on campus, or a day program where they are on campus or where they live separately from you. Most of these programs, one of the requirements is that if your child takes medications, they will be responsible for that on their own. So maybe teach them how to put a reminder on their phone. Teach them, you know, like if you put your medicine in a little pill minder, then you can see every day if you took it, or if you put it on a chart, whatever works for them. This is an important skill that they need to master while they're still living with you. Practice, practice, practice. And medication related, can he or she order a prescription refill? You can walk them through it. Now a lot of pharmacies do that in an automated way. So you get a phone call asking if you'd like to refill the prescription. And unless it requires like a doctor authorization, they pretty much can just push a button on their phone. How easy is that? But you also want to spend some time showing the medication bottle to your child. Show them how there's a number on there. You don't have to say the name of the medicine, but you need to listen and make sure it's the same medicine. And, you know, that's a really good practice for anyone. And lots of people my age who suddenly find themselves being caregivers for their adult parents have to learn how to be disciplined about doing some of this stuff as well. Even if your child with a disability doesn't take a lot of medication, maybe you're all of a sudden being responsible for all of those things. So while Joe slumbers through this episode in blissful, pain-free, a blissful, pain-free existence, thank you, modern medicine. I'm going to show you some resources. Parent to Parent of Georgia and the Georgia Department of Public Health. Both of those are great resources. The Department of Public Health has a great workbook for families on transitioning to adult health care. So if you have any questions, please reach out to us. We always love to hear from folks out in the world. Please subscribe to our channel, Transition Tuesdays with Jane and Joe on YouTube. And I hope you have a peaceful day. I know Joe's going to. See you next time.